So welcome to Medi6100. We're going to do a liver review session. If you want to join in live now in the lecture theatre, or if you're looking at this recording later, this quiz will still be live for a few days. So for example, if you're logging on to this lecture recording within a week of it being delivered, you can go to this website, log on live and do the quiz yourself. After that, I'll probably close the quiz because I'll be running some other one with some other people, and you just have to look at the quiz on the screen. Does that make sense? Anyway, go to Socrates.com and punch in Medi6100, and we will be away. So the various resources available, I don't really mind. Okay, right, let's get going. Which image? So you can run ahead on this quiz if you get bored. That's fine. Which image best depicts the surface anatomy of the liver? You know, you don't have to call it out. So we answer anonymously. And then we'll reveal the votes in a way. That's right, yeah. So the idea is, this is what's supposed to happen. We'll ask a few questions on anatomy of the liver, and then in my presentation there are some resource slides. If everybody's doing all right, we won't talk about those resource slides, but the 2 or 3 people who got it wrong, or whatever, can look at those slides and think, oh yeah, it was left to right, or whatever. If there's a lot of confusion, then we have a chance to talk about it. Right. Good. So next question. Which of the named abdominal regions predominantly does the liver lie? Okay, that's enough people answered. Terrific. So most people have got that one right. Here are the resource slides for those of you who got it wrong. I think it's from Ackland's, I think, the video position, if you're interested. This is obviously from Ackland's. Which liver lobe surface is shown in the image? Question 3. Oh, this will be over quickly at this rate, won't it? Enough people have answered, I think. So how do we do? A little bit of confusion. A little bit of confusion on the liver lobes. So left quadrate, right caudate is how it's a little word poem in my head. Left quadrate, right caudate. And the caudate sort of dangles out the back like a tail. So this one at the top is sort of wagging like a tail. So that's what caudate means. Maybe that helps you. So what structure is represented by the dashed lines? Not the area it encloses, but the dashed lines themselves. A couple more answers would be good. That'll do. Oh, we'll have a look at the suspensions of the liver. Well, I must say it's very descriptive rather than intellectual. I don't want to talk about it too much. I'll show you the slides available, because I can't imagine it being an intellectual discussion talking about suspension of the liver. However, we might be in for trouble, because there's a few questions on the suspension of the liver coming up. Well done, the lesser omentum. I think the picture's clear enough to get that right. All right. So the next few slides are talking about the attachments of the liver generally. I'm not sure there's much to describe about them. They're just showing, for example, the lobes of the liver. I know some of us got those wrong. Looking down from the top, it can be a little bit hard to orientate yourself. So there are quite a few different views of the liver, which are worth looking at in these resources. Coronary, remember coronary means crown, so like a circle on your head or a circle of blood vessels around the top of the heart. So the coronary ligament has got something in its name that might help you remember that it is a sort of circular ligament at the top of the liver. So there's a couple of resources on there. These ones are from Ackland's Video Atlas, and I have put in some extra arrows and labels to help you identify the bits we have been talking about. So I could describe them, but I'm not sure that's an intellectual exercise. That's something to look at. So I've picked about 8 shots or so from Ackland's Video Atlas that show the suspensions of the liver. So let's press on through. So excuse me not talking about attachments of the liver. I can't imagine that's a productive use of our time. So which structure is a remnant of the umbilical vein? Probably sufficient. So most people have got that as the ligamentum teres, also known as the round ligament. There's also a teres ligament holding the hip into the acetabulum. Might remember that one. So teres just means round. Porta hepatis is where a few major vessels come and go out of the liver. We'll see that later. This picture taken from Ackland's Video Atlas. Very nice selection of animations on embryology. So question 10, bit of cross-sectional anatomy, sort of conceptual really. Okay, I think that'll do. Okay, so in this picture, the large brown organ is the liver, and you see it's attached here via the bare area. Then this purple thing is supposed to be the spleen, and this is showing, I guess embryologically, you've got that foregut suspended by the dorsal and ventral mesogastrium, and then the dorsal mesogastrium develops the spleen, which is up here in top right of this picture, and the ventral mesogastrium develops the liver, and then in the mature person, that ventral mesogastrium, where it joins the liver and the stomach, becomes a lesser omentum. So that's a bit of conceptual embryology, which is quite relevant to anatomy. That was worth asking, I think. So these are the labelled extracts from ATLANS. So that video atlas does the embryology and the anatomy in handy bite-sized pieces which have a beginning and an end, and mercifully no hyperlinks. So again, here in the bottom right-hand corner, left quadrate, right caudate, some of the landmarks for these lobes, you can see the falciform ligament and the gallbladder are surrounding the quadrate lobe, if you're looking for landmarks, and the vena cava would be here in this impression, and then between the left lobe and the vena cava, you've got the caudate lobe. So there are some little ligaments, some landmarks for you there. We talked about the ligamentum teres, coming in, which is, of course, the umbilical vein. And then we've got the ligamentum venosum, which is a remnant of ductus venosus, which was shunting past the liver in the fetus, at least partially. So when we were looking at the picture on the right earlier, I was explaining the picture on the left. So the picture on the left is at an earlier stage in embryology, where if you think about a gut tube, so in the foregut, remember, let's get a pen going. Do remember, in the foregut, your gut tube is suspended by dorsal and ventral suspensions, and then thereafter we just have the dorsal suspension. So at this cross-sectional level here, we can see this is clearly a slightly later stage of that foregut, where rotation has started. So you can see sort of the motorbike handle rotation, where it goes in two planes to rotate the stomach and the spleen. And in addition to rotating, we can see that the spleen has developed, or is beginning to develop, in the dorsal mesogastrium, and the liver is beginning to develop in the ventral mesogastrium. So nice, important key distinctions between the embryonic foregut, midgut, two suspensions versus one. Okay, so it's sometimes a little bit difficult to orientate yourselves on dissected specimens, but the gallbladder is a very nice landmark here, which structure is indicated by the arrow. So the arrow is trying to indicate this structure. It's promoting a lot of discussion. Well, the majority opinion is right. So when we look at the alternatives, the porta hepatis is the name given to the area generally, where these vessels are coming and going. The central vein is a component of the liver lobules. It's more of a microscopic bit of anatomy. The inferior vena cava is running straight through, if you like, or past, or the liver. So these are going into the liver itself. So I agree it's a big vein, but it's going into the liver, which would be in distinction from the vena cava. We've had some vessels dissected out of the way to show the biliary apparatus in a bit more detail. Trying to identify this one here. Okay, so we've got a 50-50 confusion here. Let's just resolve that right now. There's confusion between the common bile duct and the cystic duct. I agree, these are very close together, a little bit hard to see what's going on perhaps, so let's go back to where I can draw. So I suppose if you wanted to resolve your confusion, you could see that this structure is continuing past, it's been cut of course, it's continuing past where the gallbladder joins, whereas this structure is not going to the gallbladder, but it's draining the liver here. So the one indicated by the arrow is actually going directly to the gallbladder itself, which helps resolve the ambiguity. So just by looking at it straight away, might be a little bit hard to judge, but start looking where other things are going and ruling things in and out, and then you can work your way heuristically rather than by pattern recognition, which is fast, but sometimes inaccurate. What are the items depicted in this image? Oh, interesting. So a phytobezoar is a collage of all sorts of different plant material compacted together. That's right. So those of you who do a bit of cooking will realize these are nutmegs. But you may ask, why have two pathology sites got pictures of nutmegs on them? So it's a bit misleading, and I deliberately led you down that route by talking about the biliary tract first, and so you were primed a little bit into thinking about obstruction. but they are nutmegs. Have you ever heard of nutmeg liver? No, well you will, you see. And so it's one of those ludicrous things where people say, oh, their stomach when infected with this parasite resembles Moroccan leather. And you go, oh, right, excellent, Moroccan liver. Or they say, when the liver is affected by chronic passive venous congestion, it resembles a nutmeg. So we call it nutmeg liver. No, nutmeg liver. Well, we don't know what a nutmeg looks like, do we? So it's ludicrous. However, now we do. So nutmeg has a variegated appearance of light and dark, and in fact the one on the left is almost brown and lighter brown. So when you look at a liver which is suffering from chronic, passive venous congestion, which I agree might be a little bit down the track, and someone says it resembles a nutmeg to the naked eye, you say, oh yeah, I guess it does. So we're now looking at the microscopic structure of the liver, so a histological image, which structure indicator A, B, C, D, E is bringing partially oxygenated blood into the liver. So quite a clever question here, because you actually have to do several things. You have to recognize which part of the liver we are in. Then you have to be able to identify those structures and know what their function is. So this is a higher level question. If you're struggling with histology, move from the known to the unknown. So these are hepatocytes, and they have a little basophilic nucleus surrounded by pink cytoplasm. So item C, whatever item C is, has quite a thick lining to it, probably cuboidal epithelium, don't you reckon? And then you think, oh yeah, okay, right, so I can now start looking at the linings of the other tubes, deciding whether they're epithelial-lined ducts or arteries or veins or lymphatics by the relative thickness of their walls and so forth. So not an easy question, but a fair question. Let's see how we are doing on that one. So the majority of people have correctly identified structure A. Go back and have a look at that. So which structure indicator brings partially oxygenated blood into the liver? Well, let's identify the structures first. So C is interesting because we've just picked out that it's lined by cuboidal epithelium. What do you reckon that is then? Oh, do you know where we are in the liver, by the way? It's a portal area, the portal triad, yeah. Because there's more than one vessel there. So, I mean, you're expecting 3 vessels because it's a triad, but sometimes they branch, or sometimes they're hard to see, or sometimes the lymphatic is quite big and there seem to be 4. But there's more than one. So we've correctly identified C as part of the biliary system. It is a glandular duct, if you like, so we can forget that. B and D are similar, except one looks like it's cut sort of a little bit more elliptically, and D is cut a bit more transversely. I guess I can start now looking at the relative. I can see red blood cells in the side of this little joker as well. So D has red blood cells in it. And the thickness of the wall, I don't know, is it about that thick? It's pretty thick to me. What about a B? Well, it's at least this thick, isn't it, the wall of that thing? Whereas A, how thick is the wall on that joker? I don't know, it's not very, it's pretty thin, isn't it? Yes, we've got thick-walled vessels and thin-walled vessels, and go for arteries and veins respectively. But in the portal triad, we know it's actually a multiple-choice question, because in addition to bile ducts, we've got hepatic arterioles, so that's the systemic blood supply proper, like any organ would have. But the vein is a portal vein. It is a portal triad, so that adjective portal means it's going from one capillary bed to another. A vein normally goes from a capillary bed back to a heart, of course. But a portal vein is going from one capillary bed to another. So we have the hepatic portal system taking from the capillary bed of the intestinal tract to the capillary, or at least sinusoidal bed of the liver. So that is a portal system. And does anyone know where another portal system is? I can only think of two. The hypothalamo-hypophyseal portal system that goes from the hypothalamus to the pituitary is carrying release hormones and things. Do you remember that one? Yeah, well, that might. Yeah. So it's only very short, but it's nevertheless going from one little capillary bed to another one. So it's actually a portal system. That's a hypothalamo-hypophyseal portal system. And this is the liver, which means, what is that thing indicated by the arrow? Interesting. Do we know? We do. Yeah. Let's have a look. A couple more guesses and we will find out what's going on. Going to one for 50-50 there. So I guess the majority have identified it as a bile canaliculus, and others have gone for a Kupffer cell nucleus. Well, I'll come on to this on the resource slides. However, if I draw the outline of the hepatocyte, then we see arguably that the space we're talking about is a little gap between two adjacent hepatocytes. So actually, if you look very carefully, it's not just a little black dot, because down here we have caught it at a slight angle. As you can see, it is in fact a little baby tube. So although when, oh I know, it's cute, isn't it? So I know when we caught it in at right angles to its direction, it just seems to be a black thing. So the bile canaliculus, so where is bile made anyway? Yeah, that's right. So it's made within the hepatocytes, and somehow it has to get to the gallbladder. So to leave the hepatocyte, it trundles through. That's right. There's an aha moment there, wasn't there? So if you imagine... Yeah, so, no, it is a tube. So imagine if you have hexagonal paving slabs, and you're going to lay them one slab thick. But imagine if the hexagonal paving slabs have a groove all the way around their edges. When you put the hexagonal paving slabs together, you have created a network of complete interconnection. And anything in that network of channels won't appear on the top of the paving slabs or the bottom. It's separate. And I say that because when we looked at the liver, in fact, on this picture here, the liver is often only one cell thick between sinusoids. So blood is flowing here, and blood is flowing here. So you can't put your bile in there because it's going to get washed away. So it has to find a compartment outside the sinusoids. And it's quite difficult to imagine how that could possibly be if you're only one cell thick. But the grooved paving slabs would do it. You may be interested to know that my driveway is made out of grooved paving slabs because I thought it beautifully mimicked the sinusoidal and canalicular architecture. No, I'm only joking. So this will be the classic, ridiculously hexagonal picture of the classic lobule in the pig, where we have the central vein in the middle. Good name for it if we're in the lobular system, because it is at the center of the lobule. And the blood that comes into the liver from the portal area, the gut, and also from the heart, is all draining towards the center. I know bile's going the other way, but that is a classic liver lobule. And even if you haven't got those fibrous outlines of the liver lobule, like you haven't in us or this dog, you can still say, well, I know the central vein is at the center of the lobule, so I'm presuming blood is trickling through these sinusoids to get to the middle. And so it is actually possible to find portal areas at the outside of this lobule, which are bringing blood from two circulations, one from the portal circulation of the gut and one from the normal systemic arterial supply. So I've indicated that there's flow in the other direction, and of course the bile cannot possibly be in the sinusoids because it would be miraculously swimming upstream against the flow of blood. It is circulating in the canaliculi, which are the little channels between the liver cells, and they are completely different from the sinusoids. So this shows that quite nicely, doesn't it? Remember, we've got a central vein where blood, or we can call it a terminal hepatic venule. So blood coming from two supplies, so portal blood supply is coming from our guts, and then a regular arterial supply, just like any organ. And these two supplies are mixing and intermingling and draining back to the central vein, and then through hepatic veins back to the vena cava and then the heart. But bile, remember, is synthesized in the hepatocytes and is sneaking into this little channel, the canaliculi, and heading back to a little bile ductule lurking there. The space of Dissa is sitting here. We talked about that, just under the sinusoidal epithelium, and electron microscopically you can see it here. Super duper. We looked at this picture on the right that shows in sort of cross-section you occasionally catch a bile canaliculus, but then there are a few places where you see it has a slightly more tubular type. This is a nice one down here, isn't it? Really look like tubes, but sometimes you get a picture shown on this side where you really can think, oh yeah, those cells are punched together and they've got a little channel between them, the bile canaliculi, beautifully outlined with those special stains. So there's different ways of looking at the liver. I'm going to show you the same liver slide with different drawings on it. So this is a classic lobular system of the liver where we've just pushed a blue dye back through this hepatic vein, and you can imagine blood is coming in from two blood supplies, both the portal and the systemic one, and draining to the middle. That's one way of looking at it. Another way of looking at it, well, you've got zone 1 on the acinar system, and zone 1 looks like it's really cosily well supplied by incoming blood, doesn't it? So zone 1 will be the last to die if there's an ischemic or hypoxic challenge to the liver. Maybe be the first to die if there's a toxin coming in. And then you can identify zone 2 and zone 3 further and further away. So it's the same drawing, it's the same histological slice of liver with dye, but there's two different ways of looking at it. And here is a nutmeg, and here is a liver that has been affected by chronic heart failure. And so the sinusoids expand and become more red, and the liver cells become pale with a bit of fatty change. So when you look at the liver to the naked eye, so the scale is a couple of centimeters, you do get alternate sort of variegated light and dark. So if you call this a nutmeg liver, you have to call this a chronic passive venous congestive hepatopathy nut. This is probably a good place to finish. Except there is a mislabeled slide in David Macy's lecture where this is correctly identified as a muscle layer. It's the muscularis propria. This red thing is incorrectly identified as a muscle layer. That's actually just hemorrhage. I don't know why that gallbladder has blood in it, but it does. Anyway, I hope that was useful revision, and I should give you a break for the next things. A couple of resource slides to flick through if you found it challenging. Oh, that was probably a nice video reference that shows the two different ways of looking at the liver microarchitecture. Okay.